I'm Abby. I'm from the Chickahominy Health Department. I'm one of the public health nurses, and I help with planning the vaccine events and outreach to businesses and residents.
And I'm Caitlin Hodge. I'm our population health manager for the Chickahominy Health District and COVID response team leader. So I work closely with Abby. The vaccine that we have right now for COVID-19 is the Moderna vaccine. It's 2 doses are required. It provides up to 95% immunity after the second dose. And right now, it works by helping your body recognize the virus and fight it off. So it helps you have immunity. It's not 100% immunity, but it's 95%, which is great.
So there's a spike protein from the virus embedded in the vaccine, and when it's injected into your body recognizes to build its own proteins and mount its own immune response against that virus. So it's not actually live virus, and it's not anything that alters your DNA or comes into your own DNA. It's something that your body recognizes and learns to fight off, similar to the way other vaccines work. So right now we are in full phase 1A, which is all of our healthcare providers and healthcare support staff. And then we are also in a limited phase 1B. We are working through our senior citizens at ages 65 and up, some of our folks with chronic conditions, ages 16 to 64, and some of our essential workers, including school employees, pre-K, and law enforcement officers, corrections officers, and our shelter workers.
Yeah, we love that question. It's a good one because we want it to get, be available to everyone who wants the vaccine and have that be something folks can get. At this time, the number of people who are eligible and within that group, the number of people who want the vaccine is a lot higher than our current supply of the vaccine. I know the governor's goal for the state is to get most people vaccinated by the summer or during the summer, by then. So that would be a wonderful goal. I think it all depends on vaccine supplies and then our just speed that we can increase our capacity to do more vaccination events that are a large scale and have more people who can administer the vaccine. So kind of growing as the supply increases. So there isn't an exact date right now, but we're doing really well.
You should still wear a mask. You should still distance. You should still use that hand sanitizer all the time to protect those around you. There are still some people who can't get a vaccine right now, like our children, and certain people with certain conditions are not able to. And so we want to be protective of them. And we just don't have a lot of data regarding if you are vaccinated, if you can still somewhat pick up the virus and transmit it to someone else without actually having any symptoms. So yes, there are some potential side effects, just like with any other vaccine or medication. Allergic reactions are a possibility. So we do some screening for people that have a history of allergic reactions, and then we do also have an extended observation time for them. And because this is a brand new vaccine, we want to be as careful as we can. So we keep a physician on site at all of our clinics to consult with individuals to make sure that they are eligible for the vaccine and that it's not an unreasonable thing for them to do. And then we also keep emergency equipment and clinical staff to observe our vaccine participants for at least 15 minutes after they get their vaccine. Some of our folks with a long list of allergies or severe allergic reactions may end up waiting a little bit longer because we want that observation period to fully encompass the time frame that they might have a reaction.
Some of the most common side effects have been arm pain at the injection site, tiredness, headache, body aches, things like that. And so it's possible that someone might have some mild symptoms like that. You've probably heard in the news too that some folks have had more severe allergic reactions. And so I think that's a very small percentage, though, of all the people who've gotten it. But we are still very prepared in case something like that came up. So if anyone is wondering if getting the vaccine is right for them, we always recommend they talk to their primary care provider before signing up for the clinic.
So we don't recommend that you take anything before getting vaccinated. There's no need to preemptively take it as if you're worried about having a fever or having any aches and pains. If you are having any aches and pains, you can take Tylenol after the vaccine, just so long as that's a medication that is indicated for you. You don't have an allergy or another reason that you can't take it. So again, anything that you're concerned about, you should run by your primary care provider because that's the person that knows you and your medical history.
Yeah, for the most part, of course, they have to talk to their primary care physician or their, OB, whoever is caring for them, and every person is a unique individual. But in general, they're considered to be part of the higher risk group for complications. So I think a lot of times their doctor who's caring for them during their pregnancy will probably encourage them if they're interested. I know it's especially helpful, good peace of mind as well for breastfeeding moms, lactating moms, or pregnant women. So it's definitely a really important conversation because they are eligible to receive the vaccine if they like it and it's safe for them. They are part of 1B because pregnancy is considered a medical condition that puts them into that 1B group.
Yes, absolutely. You do not need to wait for an extended period of time after having COVID-19. We recommend that you need to be outside of your isolation or quarantine period, and you should not have any severe symptoms or fever. Your symptoms should be getting better at that point. If you're someone who was recently hospitalized with COVID, or you had a particularly severe case of COVID, and you're still symptomatic, we do recommend that you speak with your physician and make that determination as to when you should get vaccinated. That's an interesting question. I mean, it's as
Yeah.
safe to travel after the vaccine. It's a little safer after the vaccine than it is before you get the vaccine, for sure. Ideally, you would want to wait until you got through that 2 weeks after your second dose. That's when you're the most protected. If you need to travel after you get the vaccine, your immune system isn't lowered by getting the vaccine, so you certainly can. You just want to use all the recommended precautions, just like you would in normal pandemic times.
I think it's just important to remember just because you maybe got both your doses of the vaccine, that doesn't mean that everyone else has. So there's still that 5% chance that you would get unwell, from being exposed. So it's just something you have to consider while you're traveling and the pros and cons.
So when you get to Randolph-Macon, we're doing our events out of the Brock Athletic Center. They were kind enough to let us use their gym space. So it's a nice big indoor space. And there's a parking lot right next to the building. So you'll park in the parking lot and you'll be given a number. You'll wait in your vehicle because it's safe and warm there. And we will call you in when it's time for your appointment. The wait times aren't very long. And then you will go to the registration table. They will check you in. They will seat you in a waiting area. You'll walk up to get your vaccine. Your vaccinator is a clinician, a nurse, a doctor, an NP, a pharmacist. They will review your pre-screening checklist with you, which is just going over medical conditions, medications that you have, making sure that you're eligible for the vaccine. Then you'll get your vaccine at that table. From there, you'll go over to our observation area where you'll wait for a period of time between 15 and 30 minutes with medical professionals there should there be any issue or question. And from there, you will go back to your vehicle and go home. Most people should expect to spend about 45 minutes to an hour going through the process.
So we try to keep it really safe for people in terms of distancing. So we try to maintain distancing of at least 6 feet at all times. And that's required while they're waiting to go to their vaccine table and then while they're being monitored after the vaccine. And also, that's another reason why they wait in their cars until it's their turn to come in, because we just don't want too many people in the gymnasium. And then the next really important thing is that this is by appointment only. So there's no walk-ups coming for the same reasons that we just don't want to crowd the space, because we don't want this to be a place where COVID could spread, right? Because it's still very widespread in the community. So we just have to be super careful to keep the number of people in the building low while also being really efficient with how many people we can vaccinate. So it's by appointment only. And that's just really like huge asterisks there. Like, don't tell your friends to come because you have an appointment. It's not a walk-up type of event. We have a few really good places to start. So if people like doing their own research online, VDH has a great website. It's pretty easy to remember. So it's vdh.virginia.gov/COVID-19-vaccine. And they can look at who's in 1A, who's in 1B, who's in 1C priority groups for the vaccines. And there's also a frequently asked questions, little yellow button they can click. And you can write in a keyword like side effects, for example, and it will pull up the answer that like a lot of people have asked about side effects. So it's super helpful. There's also a tab you can click on to see like if your county or city, what phase they've moved into. And so they could look up, for example, Hanover County and see that we've started to move into phase 1B. We're also still in 1A, as Abby mentioned, but we're just starting 1B. And so that will be a helpful tool as well. And then we just like to kind of help with people's expectations. So even if they see that their county's moved into another phase, that doesn't mean that they can get an appointment immediately. It still means that they're going to be on a wait list, but we'll have their information.
So we have a new hotline, and so you can call into the hotline.
It's 365-3240, and that's our new hotline number. If people call 3340 at the end instead of the new one, 3240, it'll get forwarded as people learn the new number. So there's still like a little overlap. But yes, they can definitely call, and the people on the phone can sign them up for our wait list.
Yes. And if they happen to be more tech savvy individuals, if you have an email, you can also send an email to chdvaccine@vdh.virginia.gov. And you'll get an automated email that kind of categorizes your questions and gives you a link to a survey to sign up. And you can contact our business liaison and sign up your business. So there's a lot of resources.
Yeah, I mean, my main thing is folks always want to know, like, what can I do to help with ending the pandemic? What is my role? What can I do? So we want people to wear face coverings, we want them to try to distance, we want them to stay home if they can, we want them to wash their hands often. But we also want them to now get their vaccine because it's one of the best tools in our toolbox. And so if you can, if it's safe for you and you've talked to your primary care physician and you're able to and you're eligible, then please get the vaccine, get both doses if you're getting Moderna, for example. And that way you'll just help protect yourself, but also the people you care about that you're around.